Hi, everybody. Hope everyone's well. We're sorry. We're having a little bit of technical difficulties right now. Don't you love doing these things? It's absolutely fantastic. So I'm just Holly. Can you hear me and see me? Okay. Hey, Holly. How are you? Can you hear me all right?
Sorry, it all froze for a moment.
There you go. Can you hear me okay now, Holly?
Yep.
Awesome. So we've got some issues right now with our operating system. So Holly, it's just you and I. I'm gonna we're gonna you I promised I wouldn't do this to you, but I guess now I am, right? So what I'm gonna do is we're gonna alter our format a little bit, and then when our other presenters are able to join us, we'll make sure that we include them. Okay, Holly?
Yep.
So my name is Ryan Anderson. Welcome, everybody. I apologize for being a little bit late. This is an interesting day, and that it's our very first session on behalf of our center. It's also my first day on campus. So we kind of came into campus today to make sure that the technology was great, and it's now worse than it was at our homes. So I guess this is the world that we live in now, I suppose, right? So I really appreciate everyone being here. We're really excited about our speaker series. Our very first one is going to be talking about the lockdown. Holly, you and I have talked a couple times about the impact of the lockdown on your business. And when our presenters are on the line, we'll have a bit of a conversation with them too. So just a general talk about the center. We're a brand new center entity at Mohawk College, the Center for Entrepreneurship. We'll be having 4 to 6 of these sessions. So our sessions next week are going to focus on mental health in the workplace, something that a lot of us are very passionate about and that have been impacted by as well. And this one is going to talk about the lockdown. We have had a lot of impact of the lockdown, a lot of different businesses that have been impacted differently than other ones, and a lot of inconsistency too. And this is something that I can't wait to sort of take the top off of today. So, Holly, without any further ado, I'd love for you to take a minute or two just to talk about who you are, your business, and maybe talk a little bit about what the lockdown has done and the impact for you.
For sure. My name is Holly Webster. I'm an osteopath and also a professor at the Canadian College of Osteopathy. I have 2 businesses, one in Brantford, one in Oakville. So they're both actually very different, and so having different impacts. So I can tell you about them both. Um, I in Brantford, it's just osteopathy. I have 4 rooms, and they're constantly going with other practitioners. They're actually completely closed right now. Both times, actually, we are experiencing the same in Brantford, where we've been closed 100%. Unfortunately, we're not being deemed essential, which has been absolutely terrible for us and our patients. So, but this time around, in Oakville, our practitioners for osteopathy cannot work, but our naturopaths can. Our massage therapist could also, but she got told that she's not doing emergency cases, and that her treating a patient has to outweigh the cost of getting COVID or contracting COVID. So they're deeming anyone who can't walk or somebody who really needs to be treated are the only people allowed to be treated. So every day, people who are suffering with just back aches and things like that, they're not allowed to be treated. So right now I'm getting a little bit more income on the side of the naturopath being open, but really it doesn't touch my Oakville rent whatsoever. The first time around, we received rent relief, 75%, for 4 months. And a lot of our staff we had to actually let go of so they could collect CERB. But majority of my staff is actually self-employed people who are practitioners at two or more locations, so that they actually don't get paid on salary, or by me, they get commission. So they all had to go on to serve as well. So there's two differences again with now and before. Before they all got served. This time around, the serve is very different. There is a payback if you go beyond 38,000 in earning in a year. You have to pay back a certain amount. I think it's 50 cents to a dollar above that 38, and so most of them would just be paying it all back. So it's like a little loan versus an income this time for them. What was I also gonna say? There's also a difference in rent for us. So they're only covering 25% this time, but only of your income that you earned last January. So being relatively new, my Oakville business especially, it's been open for about a year and a half. It didn't. January is our slowest month, and so we only get a percentage of what we earned last January, which doesn't cover our rent even close. So we're actually going into a deficit pretty hard in Oakville for this second time around. We're not getting the same help as we did the first time around, even though that wasn't the greatest help. It's even worse this time for us. I think the biggest thing for me also, I was telling you, Ryan, that I'm doing a lot of the front desk work from home, getting a lot of the emails and the phone calls just to keep on top of everything. And the amount of emails of people suffering, really in pain, begging me to treat them, begging us to open, like that's probably hurting me the most, not the bank account stuff. It's knowing that 10 minutes of my time could really change their life right now. And it's really upsetting that I can't do that. And in terms of COVID, I mean, I know we're going to talk about it a bit later, and I believe you're section 3, but I'm like a little quick thing about it is we're not getting outbreaks in these controlled environments. So, I mean, we've had no outbreaks in any osteopathic clinics across Ontario. I can't speak for outside of Ontario. So for me, I don't know how we are different from chiropractors or how we're different from physiotherapists in terms of being able to help the public. So I know their way of thinking is that we aren't a registered business. I'm not registered, sorry, registered, profession. So unfortunately with that, don't see us as a real good regulated healthcare profession.
It's interesting, Holly, too, and I know we've talked about this a little bit, the whole regulation side, and that the industries that are able to be regulated have got more backing behind them, a little more lobbying, I suppose, with the government, and the ones that don't are the ones, I guess, that are exposed. Is that a fair point to make?
100%. We don't have, the thing is they call us unorganized. So unfortunately, especially with osteopathy, there's two huge differences, like two different camps. There's little camps in between, but the two main ones, they're on very different pages. And so they seem to think that we're very unorganized, but doesn't mean our profession is unorganized.
And I guess having been into your clinics and your studios, I mean, before COVID, I know the work that you did to make sure that you went over and above all the cleaning standards and hygiene standards and everything else. And I know the money that you've put into your businesses right now too. And I think, the more I hear about this through entrepreneurs, there's been a lot of money. And, and hopefully when Mr. Ladd comes on, he'll talk about the fact that in the restaurant industry, the hospitality industry, there's been a lot of money spent on screens and on distancing tables and everything else. And I know with your clinic, having been there too, a lot of that money may or may not be utilized later on. It's not an investment. It's really a cost, isn't it? And that in itself can be a lot of very problematic.
Yeah, I mean, I think other businesses suffered a bit more with that than I did per se, because we already, being in healthcare, were very, very clean and sanitized, and we had protocols that were in place. So we were already doing a lot of the things, except for we added a couple of things like you said, sanitizing at the door, sanitizing at the front desk, the shield for the front desk. Those are things that can even stay up if they wanted to stay up if and when COVID is gone. One of the things we did implement was a UV medical grade UV germicidal lamp that we
Yes.
go over the bed in ourselves, not our skin, but our clothes and everything that the people touch in between each patient, just to make sure that we're killing all the germs that we possibly can, and then we wipe it down on top of that. So I mean, we do go a bit above and beyond, but we haven't had any outbreaks. In fact, we did have somebody who came in with COVID with symptoms who didn't tell us and told us afterwards. And the practitioner who treated them, because of the protocols that were in place, she didn't even contract it. She wasn't exposed, and it didn't go in our clinic at all to pass on to any patients or any of our practitioners or staff.
It's interesting, Holly. I see Pete's on the line now. Hi, Pete. How are you? Holly, I've got one other question, and I a little bit off the grid from what we decided to talk about, but you hit something that I find very interesting for our students. You said to me a couple times, and you said it here, one of the hardest thing about this is that you haven't been able to help the customers and your clients that you really got into business to help. And sometimes entrepreneurship is a great thing for our students to learn. Many people get involved as small business owners and entrepreneurs because it's a passion. The area they work in is a passion more so than making money and creating a living for your family as well, right?
Yeah.
Can you talk a little bit about how hard that's been?
I mean, one of the greatest things and arguments that we have is that we've had treatment plans in place for some patients who have been dealing with and going through a lot of things, and we've made great progress. And the first lockdown, we were closed for 3 and a bit months, and so there was a lot of regression. And this is unless you have benefits, it's almost out of pocket. And if you have benefits for osteo, it's not very much. So I mean, most of it is out of pocket, and they're gaining a lot of great results. But then to be able to backtrack and not be able to be seen, continual maintenance. I mean, some of the emails, it kind of broke my heart that I couldn't do anything. And I sat here at home, and a lot of the times I would think about patients. I have certain patients that I was just like, oh, I just wish I could sneak in and like treat them or do something about it. But I'll also kind of like nervous to see them again and see how they're feeling, because again, I'm very passionate, and these people are so close, not close to me as in like family, but I mean, like, I really care about them. I'm invested in their health, and I'm invested in their well-being, and not being able to help and seeing these emails of people in pain and begging to come back was probably the worst part, more so than the lack of money, to be honest with you.
Yeah. And I really appreciate you saying that. And Holly, I've known you for a few years, and I one of the things I love about your clinic and about the people that work in there is that they really care sincerely about their people. And that is something I think entrepreneurs are really suffering with, the mental side of this as well. Is, not only can I not run my business or do my business, but I also know that my doors not being open are impacting others as too. And I think that's something that we're not really looking at right now. I really do. And I do want to touch a little bit later on about some of the government subsidies and some of the work that you've had to do. I do talk to entrepreneurs who say that right now they need to be lawyers, they need to be accountants, they need to be public relations people, as well as business owners. And it's something that I think is a very valuable thing for us to talk about. So Pete, you managed to get through the 96 different security barriers. So I do appreciate that.
The rule of thumb is you start clicking every button on the emails and every one of them goes. And it was the one that wasn't supposed to work that worked. I'm just saying.
There you go. Story of my life, right? The door I shouldn't have been in, this is the one I went in. So without any further ado, Pete, I'd love to introduce you. Maybe you can tell us a little bit about yourself and a different version to where Holly is at. But I can't wait to sort of have a discussion with the two of you right now.
Yeah, sure. Pete Spurklis. I consider myself a business coach. I help businesses figure out how they go to the next level. So I do a lot of work with startups and scale ups through Haltech, Communitech, Mars, and a couple of the universities. I do a bunch of this work. And really, the effort has been to take my experience, and I've got about 30 years of sales and marketing experience in high technology, and everything from I was CMO of a number of companies, but the most fun I've had is working with about 140 small and startup type companies over the last few years, and getting them to reach their potential. And so that's what I spent most of my time doing. Right now, I work directly with Haltech and a little bit with Burlington as we work together on that task force. And it's really about helping small businesses figure out what to do with what's going on. And COVID was it was an interesting time for coaches because suddenly there was a really big demand for help with dealing with something they didn't know how to do, but there also was no funding available for it. So a lot of that work became, pro bono, and because I'm kind of in the same with Holly, is that I really want to help the companies, help the people, and the money is secondary, right? It's really about helping them better their lives. And when you got into the COVID thing, I mean, some of it was not just bettering your life, some of it was pure survival for a lot of companies. And some didn't survive, frankly. That's just the nature of the beast. And so that's kind of what I do.
Yeah, it's interesting. Reading a study the other day by the Canadian Federation of Independent Businesses. They say that in Ontario, they think that 1/3 of the businesses may not make it through this next lockdown. And then speaking with some people there, they've been very hesitant, Pete, to start throwing numbers like that out, because we do hit the panic button and we do get very concerned. But I think it's time for us to say that, and I think it's time for us to go and say that there are a third of the business owners out there that may not make it to the other side. A question for you, Pete. You're dealing with, Holly is sort of in her area where she's trying to, to make sure that they're sustainable. You're dealing with many businesses right now that are in similar boats. Are there a couple common threads that you're seeing there that people are struggling with? Is it the digitization? Is it staffing? Is it marketing? Where can you sort of maybe point the fingers to?
A couple of areas that come to mind. Certainly, the biggest thing is the realization is, oh crap, what do I do about this? So it's a strategic view. Yeah. Do I ride the wave or do I pivot my business? So the pivot has become an enormous part of the discussions now. So when you think about the work that you're in, let's say you were a small brewery, and so you made, what was one of the companies, made moonshine, of all things. Never realized I liked moonshine, but apparently I do. It's a completely different kind of a taste. But they realized that they were going to lose some on the moonshine side, but they found that they could pivot their business to make hand sanitizers. So if you think back to March, April, May timeframe, what were we out of? We were out of toilet paper, we were out of hand sanitizer, PPE equipment, that kind of thing. So any business that could have found a way to pivot to go into that space using their existing skills or facilities, that was probably a smart thing to do. The challenge, though, is do you morph your entire business to that? Because how long will it last? Give you an example, PPE, people were starting to make face masks. So if you remember back in the early part, finding a face mask was a challenge. I used a bandana. I had a Jimmy Buffett bandana. So that's what I put on my face and tried to make the best of it. And so some companies started making their own bandanas. But if you look today, there's more than enough face masks out there. So if you were making those, that business is kind of done now, because people aren't going to be buying a whole lot more. They think this thing will end, but it's not going to end for another, until everybody's vaccinated and whatnot. It'll be late in the year, right? But would you have changed your whole business over to move to that? And so those are the strategic decisions that they really had to think about.
I've been working with a company in Cambridge who they were doing Tesla parts and work for Tesla, and they've now pivoted. They're doing PPE masks, to supply to the hospitals. And one of the conversations we had the other day was, well, when this does end, and who knows, now what? And it's not going to be easy to go and pivot back, if you will. And that's something that I think people have to take a look at as well. Just to change it really quickly too, Holly, to ask you about staffing. You've got people right now in your business that are independent contractors in many ways, and that they're very qualified. They're all have been fantastic in the ones that I've been dealt with, but they are independent contractors. They do have bills to pay. Do you worry that you might lose staff on the other end of this?
No, because it's not like they're not in the same boat. Like they can't leave and work somewhere else. It's not like I'm the one stopping them or my clinic's stopping them. So I don't believe I have a really strong staff and a very committed staff. Like we're all very close, and we continue to teach and educate each other. And I did teach most of my staff at the college, so there are still those continuing educations that I do that they can't get anywhere else. So that's a benefit too. But on top of that, their patient base is already with our clinic. I'm not afraid of losing them. I'm more afraid of losing front desk because getting good front desk staff is very hard. I'm telling you, the number one thing about starting up a business for me that I didn't think about was how hard it would be to get staff, not just staff in general, but good staff, like people who are there to work, who care about your business, even a half of what you do, because no one will like your or love your business like you do, unfortunately. But there are people who come to work and clock out, don't think about your business again until they come in. And there's people who, I'm not like I want them to bring my business home, but I mean like people who are, live for that job or for you or to work, or I don't know how to say that properly, but a quality staff, let's say. Those are the ones I'm scared of losing because they can get jobs other places at this time. Whereas my practitioners, I'm not too worried about because they can't practice. So,
I think it's interesting. I often have said in my own career and in teaching too that you can't ever put a value on someone's competency. You can't ever put a value on someone's on a first impression of someone when you walk in. And those are the jobs that when this when we do sort of get back to whatever normal is going to be, they're the jobs that are very transient, aren't they? They're the jobs where you can go from one place to the other, and they're also the jobs that in some cases take the most amount of training too, because they're people that you are at the front of those businesses. Pete, are you seeing the same thing in dealing with some of your clients?
Yeah, there's a real wide variety as to what the strategies are. So when it first happened back in March, everybody was panicked that, well, what do we do? Is there government support to help us pay for some of the folks? And you had different views. I mean, there were some people who could afford it, who kept all their staff on and paid them full salary the whole time, and which was great, but they were able to afford it. Most of the companies weren't in that kind of a position. And so some immediately laid off all the staff that they get away with and took whatever government funding was available to them. And so really we're thinking about it as an afterthought as terms, can I get them back? So you always go through the view of, if I got certain key people that I've absolutely got to have, and there's nothing I can do to keep them, then they will go out of their way to do it, to see what they can do to maintain that. And the government programs, in many cases, I think helped with that. But there are others that if you had, the experience was not common. So I see Holly shaking her head and said, yeah, it wasn't the same for everybody. And so a lot of people went through different challenges. And so if there is some available, certainly you should take a look at it. I know they've just come out with a new one. I don't know what the details are on the new one as well. Holly looks like she's snickering on that one as well. Is there not? What's your experience been with it?
Well, to be honest with you, wage subsidies were a great thing if you were continuing to work, but my place was 100% closed, unable to be open. So I had no wage to get subsidized. So I had to let my people go so they could get income. So that was very different. This time around, I find they're doing less than half of what they were doing before. So.
It's interesting, Holly, you said something when we first got on, Pete, I think before you were able to jump on. Yep. You said that much of the government support is evaluated based on your current month that you're applying. Is that correct, Holly? Can you tell us more about that?
The new one is. So the rent now is based on 25% of your income at last January. So we're closed mostly for January. So they're looking at your January income right now, and they're giving you a percentage of it. But January is my slowest month. I mean, slowest, because everyone renews their benefits in January and just maxed them all out in December and had a lot of treatments. So it's kind of like, I still have patients, don't get me wrong. Like my practice, for instance, I don't have a dull day. Like I can't fit more people in, but my staff can. There's room for them. But if you're basing it off of January, especially with Oakville, because Oakville is brand new, it's a year and a half old. We're not even covering. We were this time last year. We didn't cover our rent, so now take 25% of that, and I'm still not able to pay my rent. So the help is a lot less this time, which is scary for me. Yet I literally said after the last lockdown, I don't know if Oakville will survive another lockdown if there is one. And here we are in it, and grasping at straws of talking with my accountant every day, seeing what we can apply for, what we can do. To be honest with you, RioCan is who I'm renting through. They've been really good to me. They ask me if they can cash checks and when they can't. And I told them before, unfortunately, before our lockdown, I was doing really well. Like our numbers bounced back really. Like we got way busier. Our numbers were beating our last year's numbers, and then we had to close again. So it was like seeing the light and then, taken away. So I told them, I'm like, look, we're long term. We have a 10-year lease with you, so like you can take like no money for a couple months and have us for the rest of the 9 years, or you can kick us out. I don't know what else we can do. We can't really afford to stay open. I mean, we're still paying our build out, and our build out loans are getting no reprieve. So I mean, we're not only paying rent and paying our loans, we have no income. Like we're not just like I don't even know where we're getting money from to pay. Like I'm playing like shifting money around. Yep. So I don't know how long.
Can I ask? Sorry, Holly. I love that you mentioned something called build-out loans. I think for entrepreneurs that are in waiting and students, it's a fantastic thing for them to learn about. I'm going to go back to that for a second, but I think I'd like to, something else that hit me as you were talking, and Pete, I think you'd have some experience with this too. The constant question always for an entrepreneur is, I want to work on my business, not in my business. And what we mean by that is, I want to work to make sure that my business is building out. I want to be the CEO of my business, not a department manager. And I don't want to be the lead accountant, and I don't want to be the person that's dealing with collectibles and accounts receivable. I want to build my empire. And that's something that, Pete, I think you'd agree, we often teach entrepreneurs, don't we, is to go and say, we want to make sure that you work on, not in your business. It sounds, Holly, now like what's happening is you're working so much in your business, the long-term plans are sort of being sacrificed because, for obvious reasons, you're working to save today, not so much what you may want to do to expand or scale growth, which I know you've talked that you'd like to do. Is that correct?
For sure. I mean, to be honest with you, my end goal was not to be doing as much with the business as I am, but to start off in order to pay bills and do things. I took on a lot of the load. So I'm a practitioner at a full practice, and then I'd come home and I'd do the rest of the work that I needed to do. So I just take it home and I'd sit in front of the TV and I would get all my paperwork done, which I don't recommend all the time. But I did get an accountant, and they were taking on that. That was like a small but huge thing for me. But I still do like the payroll. I still do the scheduling of my staff and those things, and it's still my baby. So I still, even though I've given some things away, I still go over everything that people have done to make sure it's on the right track. So I don't know if my business is I don't know if I'm doing more of that, because I think the only thing that I've continued to do more of is answering emails and calling in and taking messages and things like that. Because the other stuff I was already doing a lot of. So I haven't got to that point where I can pass it all off yet.
Yeah. Peter, are you finding that with some of the businesses you're working at, is that there's a lot of again, working in, not on, and as a result, we're not ready to go once our veil of COVID's lifted? Are you seeing the exact same things?
Oh, for sure. When you get into these kinds of scenarios, you're kind of into hunker down mode. So if you have to lay off people, for example, the work still has to get done. And so it's the entrepreneur, the buck stops with the entrepreneur, right? you get the benefits when it goes well, and when it kind of sucks, you're kind of sucking along with it, and that's just the way it is. It's kind of handy to be that to be where the buck stops, and so the stuff has to happen. I mean, you can put time management stuff on and says, okay, well, here's the stuff I have to do, here's the stuff I don't need to do, so yeah, let's push that off. And in times of emergency, and this is a crisis, no question, this is crisis management. I wouldn't say that this is something you would expect. In fact, I doubt any entrepreneur, including me, expected this, right? The concept of being shut down for a year from just kind of, you see it on TV as, oh, this could take you out. We never paid any attention to that kind of thing. Figured it would come back. It didn't. So now you're into this survival mode. I've got to get this done. I've only got so much time and so much money, right? If I could hire someone to do it, I would. But if I can't, and my revenues are threatened going forward, is this where I would spend the money, or do I spend an extra 2 hours in front of the TV doing paperwork or doing the budget, right? I mean, those are trade-offs you've got to make. And when it does get lifted, and revenue starts coming back, it really goes by what trigger. If you get the revenue back, you can start to hire people again. But if you don't get the revenue back, you may have to go another month while you have to still keep doing the crisis management. Then start working on your business and trying to figure out how you can take it to the next level. So it's great to talk about the theory and the strategy, but when you're in crisis, it's wartime. And you really have to look at it as, we're in a war. We need to do everything that we can to get through this damn war, and come out the other end, right? The mission for that third of small businesses really should be, I got to get through this for the next, to whenever the thing ends, as opposed to keep planning above that. Right now, you may not be able to afford that planning. If you have some extra time, by all means, do that and position yourself. But when you're in crisis mode, it's really tough to see anything beyond you trying to dig yourself out of the ice in the hole that you just fell into in the lake, right?
And I think too.
Sorry, Ryan, I just wanted to piggyback off that. I totally agree with that. I mean, when you're doing this class for future entrepreneurs, and I mean, hopefully they never have to experience any of this stuff. Like, hopefully after this, we've kind of got it out of the way, but I mean, the main message of it is still the same. In fact, like, you don't know whether or not you're going to be busy right away, or if you're going to have lull months where you're not going to, make the income that you're expecting. And you have to be willing and able to adapt to that. And I think I saw a meme that hit home for me once. It was like, entrepreneurs are the only people who work 90 hours a week just so they don't have to work 40. And yeah. It's so true, because although those hours accumulate, it's for you, it's for your babies, for your future, it's for it's for a different purpose. You're not working for someone else. You're trying to get your business up and going. So you're willing to give those extra hours. You don't see them the same. It's very different that way, but you should expect to take on a lot of those things sometimes, because you may not go through a pandemic again, but I mean, you might go through lulls, or we might go through another crash, financially with the markets. So you never know what's going to come. You should be prepared. I mean, I was underprepared. I'm saying this now. I went into this very I want to work for myself, and I'm going to build a business so I can. And I just eventually wanted to just treat and let other people do it. And I didn't realize how much I'd be taking on, but I've learned a lot doing it within it. But yeah, being prepared is half the battle for sure.
I think, one of my fears, Pete, and sort of the steps that you and I walk through, and is that we've got a lot of people who are entrepreneurs who want to be entrepreneurs, and they have a passion for whatever industry they want to work in. They want to own their own business, and this has just scared them straight, hasn't it? And that's something that I often really concern myself with as well. Is a lot of people, it takes a certain characteristic. Maybe it's craziness, Holly, I'm not sure, to be an entrepreneur, and it's. I do worry sometimes that people now go and say, you know what, I'm gonna get in the back of the bus and let someone else lead, because this stuff's crazy. And I think that's something that I think, Pete, we have to make sure that we still promote the fact that entrepreneurship is fantastic career. It's fraught with opportunity. It's fraught with danger. It's fraught with failure. It's fraught with success. But it is something that I do get concerned sometimes, especially for our students, to go and say, you know what, there is still a lot out there. There really is. So, Holly, I want to ask you just about build out though, because we actually had 2 questions that were typed as you had asked about that. Can you explain what build out is? And then Pete, what I want to do after is pivot to the actual lockdown itself, the effectiveness of the lockdown. So Holly, if you could take a second to explain that for us.
Build out of, like, you mean
of your business? You said you took build out loans to start, and I'm familiar with what you had done, but
Brantford, I didn't have too much of one, to be honest with you. I got an open space that used to be a salon, so I just had to put in some walls. But Oakville, it was a big empty space. It used to be a bulk barn, and it was pretty gross on the inside. So there's a lot of like old food that was left when they moved out, and rotting tiles, things like that. So we actually had to get a huge loan to do that. And as we were doing it, we came across a lot of things that we didn't realize, like our HVAC needed to be completely redone. And that right there was an extra like $30,000, just things you weren't expecting. So our loan ended up getting a lot bigger than I initially had proposed, and little things that kept popping up, and it's just like, oh yeah, okay, 1,000. Oh yeah, okay, 1,000. Oh yeah, and then you look at the end bill and you're like, what? Like this is, it was a lot, but I mean, everything necessary. There was nothing, that we didn't go crazy or anything like that. I mean, I could have held back, but a lot of my things that I could have held back on were the wow factors that when we first opened made people want to come in. So, I mean, I've always been the kind of person who's like, show them what you are right away and bring them back versus like building up to it. But not everybody would be successful doing it that way, to be honest with you. I'm not even 100% sure yet that I should have done that. But it is the wow factor of when people come in that like help bring people back, things that we have available that other clinics don't. But that build out was pretty huge. And so the loan on it, the percentage, because I was a business that had no, what's the word? Equity. So I know I was brand new. So we're paying almost 9-10% on this loan, which is kills me every day. But with that bill coming out every month, they're not letting us stop paying during this time. So it's been an add-on for us for sure.
I think, Holly, one of the things that jumps out to me is you are such a fantastic example of someone with a passion with from what I knew as a talent in what you do, who's taken that to a business. And when you had mentioned about, taking extra steps to draw people in, my first thought was, well, one of the very first things you do in business is you look for investment, not costs. Is this something that long-term that we can bring customers in? I think this has also stopped us now as well, aren't we? We're looking things more on the cost side, not the investment, because Pete, as you had said, this is crisis management. And so that's also something that's concerning, isn't it? That, the long-term impact when things are lifted, we still have a life to live. We still have a business to run too. So that's something that we may see to be a little bit different too. So I'd like to turn the discussion now toward the actual lockdown. In speaking with partners, and I see we've got some people from Scotland on the line here, and I know they've had some different ventures. In talking with some business owners and talking with some members of government over the last couple of days, who, by the way, we did invite to attend. The efficacy of the lockdown, the goal behind locking down and balancing public safety with the need for us to live our lives the best we can. I think we can debate all day long whether that's been effective or not. But from the business owner standpoint, Holly, I'll turn this to you. Has the lockdown, has it met both sides of balancing the public safety as well as making sure that you could operate effectively?
For me, it's a controversial thing, I think, for a lot of people, because there's some people at the other end of the spectrum who are like loving the lockdown and think it needs to happen. I'm somebody who is in healthcare, and I've been reading research upon research and all the factual stuff. I'm not looking at conspiracy things. And anytime somebody writes something, I also research the person to see what they might also be benefiting from if I was to read this and go along with their thought process. So I also have a history in immunology, so it's very helpful when I'm reading these papers on COVID. So for me personally, I don't really believe the lockdown is the answer. I mean, even WHO's come out and said it's not the greatest thing. I think there's two ways to look at it. You could have done a complete severe lockdown for 2 weeks, and I mean like everything shut except for emergency services only. And no gas stations, nothing that would make people like want to go out, or like if you're at a gas station you need to explain why or something, where everybody's closed, because that's the way that you'd stop a spread. Other than that, I don't want to swear, but it's like half asking it. Do you know what I mean? Where you have some things closed and some things not. And so if you're looking at outbreaks and where things were contracted, it was never in a controlled environment. Like, for instance, our clinic, where we know who's coming in, they're sanitized, everything's done like to a T. It's when everything's funneling to these big box stores. So instead of keeping mom and pop shops open that might sell the same things as these big box stores, and it would more likely spread out the public, you have everybody funneling into one place, standing in line, touching the same things, putting products back. And so that's what you're seeing, is our numbers are still going up. And it's not because lockdowns are working. For me, I think most of the spread comes from family. It comes from family, friends, people not staying home. And so I think there's more of a repercussion on health, mental state, people's state of well-being in terms of bankruptcy or being able to pay their bills, and then therefore also there's been a couple suicides over not being able to pay bills. I mean, at the end of the day, this is something that has a 99.8% survival rate. And I know it's hard to say there have been deaths, and I know that's one of the things for people that, if it's affecting your family, it's affecting your family for sure. But for 99.8% survival rate, it's the same as the flu. And we do have deaths with the flu every year. Yes, it's more contagious at this point. But I think now that we have things in place, like the first lockdown made a bit more sense because things weren't in place yet, but it gave us time to get them in place, like having hand sanitizer, having the UV germicidal lights, having the protectors for the cash register people, wearing masks. Those are things that we've all implemented, and I don't believe that we need further lockdown because of that. If that makes sense. I believe the first time made sense because we didn't have those things.
Holly, I think, part of business and part of being an entrepreneur is learning from your mistakes in the past and then learning from previous behaviors. And I like your point about the fact that we've been through this once, and, did we have to sort of go through this again? And I think we'd argue this all day long. But I do really value your points a lot, especially with you in the healthcare industry. And that to me is an area where we have to learn from and we have to listen to. But, when you mentioned a 99% cure rate, if you will, and then you talk about the fact that a third of our businesses might may not make it through this, I start to take a look at those numbers and I start to really wonder where are we at. So, Pete, from your experience dealing with your businesses and even your own opinion, where are your thoughts on this? Was the lockdown the right way to go? Has the government got this right this time?
I think the challenge is nobody knows. I think everybody has an opinion on it. And so we have, in my view, you trust the people that you trust. And so we elected a government, and we have a majority government with 34% of the vote, as I recall the numbers, says, park that issue for a second. But they're responsible for the healthcare of Ontario. And I think this is replicated around the world. the thing that I think we miss on is the transparency in the data and the facts. And I think that's what frustrates folks. If you look at anything to do marketing, the big thing we spend time on is what is the perception out there. And so if you hide something, if you aren't totally clean with what's going on and why you're doing something, then people will fill in the answers with something else, right? And that's what I'm not seeing here. And because I keep coming back to understand the death rates are low from one perspective, but I think the way the government looks at this, nobody's ever said it, but they're responsible for our healthcare because they fund all of our healthcare. We can't get healthcare outside of the government in Ontario, right? We don't have two-tier. And so they see these forecasts and are saying, oh my God, there could be 6,000 cases a day, which 6 months ago was unthinkable. Well, now we're at half of that number, right? We're right at around 3,000 right now. Unfortunately, the death rate appears to be a little bit lower. The thing I keep coming back to is, well, what is it we're measuring the effectiveness against? And is it worth it? And the thing that I keep coming to, and they don't talk about it a lot, is the availability of ICU beds and ventilators. Right? That's what personally concerns me. But they don't talk about those particular numbers. So I'll give you an example. I do notice they say, here's how many cases a day, here's how many are in hospital, and here's how many ICU beds we have. But they never tell me what the capacity is. So I never know whether that's a good number or a bad number. So should I be freaking out or should I not be freaking out? And it goes back to whether it was successful was what was the objective of it. I don't think the objective was to screw over our small businesses or to hurt people or kill people, but there was an objective. And I don't know if it was a political objective to say, look, we can't have, and I would guess it would be the politicians saying, look, we can't just have 20,000 cases a day and all these people dying and we can't react to it. So they're trying to figure out how to react to that in the best way they can. And they've got doctors, our health officials telling them what to do. So, but I don't think anyone really knows. And applying data and turning the data into information that can be used is the challenge. And you got to be clear. I mean, I don't understand honestly why big box are open and small businesses are not. Don't quite get that. Right. I mean, I go to the Costco and I do notice now there's a big thing on the door. I was a Costco fan before this, but it was 468 people can be in this store. And I assume that's just, it's easier to get people in there and they can manage them better. But I don't know. And that's something I think they should be very open about. It says, well, here's why this can open and this cannot. Because I don't think like the big box stores are bribing the government or anything. I don't think there's any like side deals on it. I don't know what the answer is. And I think if there was more clarity around the why we're doing these things, I think that would really help a lot. There was a story I saw yesterday where they were talking about why they closed one particular store, and the owner was saying, was complaining a lot about it. But when they explained why they did it, the owner goes, "Okay, I get that. I may not agree with it, but I get it." And so that's part of the challenge is nobody really knows. I don't think it's a definitive black or white answer.
I think a huge part of it also is the inconsistencies that go with it. For instance, cleaning ladies can go house to house to house and clean right now, and I can't be open, which to me doesn't make sense because they're going into someone's home, touching all the things that they do, and then they're going to another person's home. Even if, they pet your cat, your dog, like it's been known that it goes, attaches to hair. My dog has hair for fur. You know what I mean? Like, it's not saying like I appreciate the fact that my house is getting cleaned. But at the same time, they're too inconsistent with what could be open and what can't be. And I think that's causing a huge uproar in society right now.
Well, I think that's, to me, the biggest challenge that you have, isn't it? The fact that, that your osteopath services can't be open, but your massage can be. I can go to a dental hygienist and I can get my teeth cleaned, but I can't go to osteo. I think there's a lot of those. Pete, you and I can't meet at Starbucks for a coffee, but if I really want to talk to you, I'll just say, hey, get groceries at Costco and I'll talk to you then. And I think that's where a lot of the inconsistencies come in. And Pete, I like what you said there. None of us have been through this before. and none of us have a playbook for the apocalypse, and none of us have these things that we have. But I will say that we have been through this before now. We have been through one of them. And I do think that, the absence of numbers that relate COVID cases to small businesses it's not there. We don't see it. And so as a result, I think that skepticism really grows in many ways. So we do have a question.
Because if I remember when the government was coming out, they said, well, we've got all this data and we're going to tell you the data and we're going to show you but data isn't information. We need to interpret the information. If they've got something that says cleaning ladies are okay to do this and this isn't, okay, tell us what that is. Like, explain it. And people, I find if you explain the concept behind it, you can debate it with them, first of all, but at least they'll understand it and they can tweak whatever business you're into to kind of go make it. It goes back to the pivot. But if it's just these are open, these are not, don't ask me any questions about it, that is the way to get a whole lot of people really ticked off. And entrepreneurs, frankly, are, as we said, we're crazy. And we don't mind talking up about it, and we don't mind causing a stir and say, look, this isn't fair. The Costco's open, but my grocery store can't be open, or whatever the connection is. It goes back to being open with the data and being able to defend it, as opposed to saying we have it, we have it, trust us. The trust us thing doesn't go that far in anything, not only government, but in business.
Especially when there's so many things that contradict it. You need to talk about it. For me personally, another thing, sorry, Ryan, I know you're about to speak. The number one thing that has combat this 100% has been improved immunity and making sure that you're healthy, because the healthier you are, the more you can come back from COVID. And it's been, taking vitamin D has been proven to be huge. Taking vitamin C has been huge. Keeping exercising, keeping moving, keep your blood flow and lymph flow moving so that you're cleaning it constantly. That's one of the things that really irritates me about osteopathy not being open is our main job is to remove obstruction of nerve artery, vein, lymphatic, make sure that your healthy blood and your immune system can flow through the body the best that it can, because nothing you do fights anything, disease, anything you take, if the blood can't get there. And so that's one of the major things that we do is make sure your blood flow is great throughout. And so if anything, we're more health-based or like natural-based that will get somebody better or prevent, because we should be on the preventative side versus reacting, than osteopathy. And that's one of the reasons why it makes me so angry that we can't be open, because cleaning your teeth is one thing. But I mean, when you're in a pandemic and you're scared for this virus that's going around that's going to affect your immune system, you need to do what you can to make sure your immune system's at the best it can possibly be before you get it. Because at this point, I feel like it's just a matter of time. Everyone's going to get it.
Yeah. I do have 3 questions, and I'm worried that we may get timed out here a little bit. So a quick one, Holly, I'll throw this at you and Pete, maybe, for 30 seconds each, if you will. Do you feel, the questions that come in from our audience, do you feel that small businesses have been treated unfairly through this, whether that be in the lockdowns and or the aid and the subsidies that they've actually received? Holly, I'll throw that to you, and for maybe 15 seconds or so, and then Pete, over to you.
I think they kind of both go together. If you're going to lock us down, you need to give us better help. If you find that we're the problem, you need to make sure that there's going to be a bigger problem if we're all closed and there's no jobs. That in the long term. So if you want to close us down, lock us down, you should give us ample support to do so and to survive that time, I believe. I do think that small businesses are being looked at as the major problem, but I think the small businesses were actually the ones that were only letting 10 people in. We're cleaning and sanitizing. I don't think the outbreaks came from any small businesses, even though they were being blamed for it. So yeah, I think there was a little bit of unfairness there, because you see the pictures people are posting of Costco, of Walmart, and people picking things up and putting it down. The next person picks it up, puts it down, and they touch their face. And so, it's a very different environment than going to I know my convenience store around the corner would let 3 people in at a time. and then they would wipe things down when you left. Like it was a controlled convenience store versus going in and getting, stuff from like a grocery store. So for me, I do believe that we're being treated unfairly. I feel like we took the time to spend the money and to do the research and to implement the things they asked us to, and therefore we should be able to maintain being open. If there's an outbreak, sure, we'll close, we'll clean thoroughly, take 14 days, But I mean, we proven. I don't know if you know this, Pete, but prior to you coming on, I was talking about we had a COVID case come in, like a pure COVID case, had symptoms but hid it because they were behind a mask, just because they wanted to get treated. And all the stuff that we had implemented, the practitioner who treated them, when I'm talking treated, are like holding them close, didn't contract it because of the things that we had implemented. So, I mean, I believe that we implemented those things to be safe, to be open. We jumped through the hoops. You should have let us remain open this time, I believe.
Mm-hmm. Pete, would you agree?
I know it was longer than 15 seconds.
No, that's okay. That's okay. Pete, would you agree?
Yeah, and there's no question that I think the small business is bearing the brunt of this. And if you think of the engine for Ontario and Canada for that matter, it's the small businesses that are going to create all the jobs going forward. That's been the case for some time. It's going to be the stuff that grows. So for the entrepreneurs on the line, we need you to be entrepreneurs and build companies so that you can hire Canadians to go, because the bigger companies aren't hiring as much. And because they're feeling the brunt of this, for all the reasons we've talked about, yeah, I think they're getting treated unfairly. I don't think it's like an intentional, we're going to screw them over kind of a thing. It's an 80-20 rule. They're in crisis, so we focus on the 80% at the high end to make sure that the government can pay bills and the banks are fine and all that kind of stuff. And the 20% tends to just suffer, and that's unfair. And I think the more we can put on to helping the small businesses enable the future growth, right? We got to get them out of this. We can't lose a third of the companies, because we're going to lose a third of the job creation going forward for Ontario. So all of the stuff they're doing, and they're doing a bunch of stuff, Digital Main Street, there's a whole bunch of programs the government has that if they're not taking advantage of, by all means, let's have them take advantage of it.
And I think too, one of the things that I'm speaking to my contacts is that whole concept of aid fatigue is, there's so many things to apply to, but as we had said before with Holly, I've got to work in my business so much. Which one do I apply to? Which one do I am I covered? Is this the right thing? The bureaucracy behind it, and before long, you're digging out of debt in a lot of ways. So I think there's that concern too, isn't there?
There's also a concern about if the rules aren't really clear on how to do something. The repercussions are strong. The one I'll use is I think it's a CERB benefit, where small businesses were allowed to apply for benefits, but they said as long as your income was $5,000. Well, they changed their mind and said, well, it's net income. It had to be $5,000. And so if you took your expenses off, you didn't qualify any longer. Apparently the number was a striking number, like 200,000 people got letters saying you may have to pay the money back. And it wasn't clear whether it was income or net income on the paperwork. So so that adds even more to the stress, right? Do you want the CRA coming back after you for something? No, that's the last thing I want in a time when we're trying to get help for this kind of stuff. And so clarity, again, what exactly is it? Can I get it? Make it easy. Please make it easy. And they've been working hard at that. The one program I mentioned, this Digital Main Street, helps small businesses get digitized. So build a website, social media strategy, and it's paid for by the federal and provincial government. There's these teams that help through Communitech and Mars. But that's super simple to do and get the resources. So that's the kind of model I think is a great way to look forward. So they are trying to do that in some areas.
It's interesting, Pete. I know with our center, we've been looking quite a bit at digitizing businesses and dealing with our agency team and things, and that is something that a lot of businesses now have really had to pivot to. But it's also talking about comfort zone. I mean, if you own a small business that's always been something brick and mortar or out of your home, and now all of a sudden you can't do that, you have to do something by digital or Shopify or do these things. There's a big growth curve there that might take you 6 months to a year in normal times, let alone now the fact it's the only way I can run my business. And so I know at the center, we're finding those things too. So a question, Holly, that's come in for you. Is there anything you would have done differently through this?
You know what? To be honest with you, no, because I didn't have a choice. I was shut down, and my job, there was at the beginning some people doing like osteo treatments over like Zoom. I don't. That's impossible. Like, you know what osteopathy is? That doesn't make sense to me at all. So I mean, there's no way I could have adapted online. There's nothing that, you know, I'm not selling products that people need or can't get from somewhere else. Like we do like have doTERRA there, but I mean, anyone can get doTERRA from. They're not going to come shop at my location or my online. I'm not even set up for an online store, so it would cost me more money to do that than the income that I get from those things. So I wouldn't have changed anything because there's nothing I could have done. In terms, yeah, I would be able to. Just a quick thing that I was going to mention, though, that from what Pete was just saying, a lot of the stuff that people were offered, you had to be open for a year in order to receive it. And so any new businesses that had just opened that year, those were the ones that probably I feel got hurt. And I'm lucky I was in just under the cusp of like 1.5 years to be able to take advantage of those things. But it's a lot of your numbers had to show a deficit from the year before in order to get anything. And if you weren't open, you couldn't actually receive any help. So that was interesting.
That's I didn't know that, but that's another example of digging deeper and sometimes finding out some of these applications that many people wouldn't have known about. So it's interesting. Pete, the last questions come in. I'll throw it to you, and then we'll wrap up. What is your biggest concern moving forward for small businesses?
It may well be psychological, from the perspective of, holy crap, like you wouldn't have seen this one coming. When I work with small businesses, we often have the conversation of something that came out of the sky at them. I'll give you an example. We work with a small tech company that creates a product and sold it. And they were doing well, growing as normal. Well, they sold their product to a company that then tried to pirate their software and resell it to somebody else. So they created an own competitor with their own software. And so the problem with that is you immediately had to go and defend that. And if you let them do it, you couldn't stop them from doing it in the future. So it's those things that just like meteors come out of the sky and hit you. And those are the kinds of things you sort of expect, right? You expect to get, I don't know, an audit, or you expect a new competitor to come in. So one way to look at the COVID thing is like the worst competitor you can imagine just came into your space, and COVID's going to compete with you now, and they're gonna provide a better product. My concern with the entrepreneurs is you have to have this passion like that Holly has. I'm going to make this thing successful. Yeah, I mean, it's struggle from time to time, but I want to make it happen. I want to be my own boss. I want to be the next owner of Amazon, right? The richest person in the world. I'm going to run this unicorn. Well, yeah, okay, there's some of those. But you have to be willing to take those kinds of risks. And having something like this come up, I think could really deter entrepreneurs going forward. Because it would, my God, like, would you open a restaurant right now? Wow. You would never have thought a restaurant was like a super high risk thing. They change a lot. But the concept of opening the store, making, I don't know, a veal sandwich shop at the corner mall, thinking, well, I'll sell some, probably, but then to have somebody come in and say, well, you're shut down for 6 months or 3 months or a month, and you have absolutely no revenue. Like, those are risks that they're external. They're, when you do in business school, you guys would have gone through a SWOT analysis, right? Strengths, weaknesses, opportunities, and threats. The strengths and weaknesses, we're not too bad at controlling those. Those are internal, but the opportunities and threats, often we used to skip over those when we do these SWOT analysis. Oh yeah, there's a risk of this and a risk of that. Now people are going, crap, there really is a risk here. And so the concern for small businesses, will people continue to take that risk and spend the 90 hours to get a 40-hour paycheck? Right?
Yeah. When the government already makes it really hard to open a small business. Like, it's, you have to jump through a lot of hoops to even do it in the first place. So.
Oh, it is for sure. I remember when I took a small business course, I think when I was doing my MBA, and it was the only prof that did it back then. And he was funny. And what you took from it was, boy, if I knew everything that could happen, I probably would never do this.
Yeah.
So you need a mindset of, no, damn all of that. Oh, damn the torpedoes. We're going to go do this thing. I'm going to be successful. You need to have that mindset. And if
That's
you're
interesting you say that. For me personally, I remember after I opened Oakville, because it was a bigger beast than my Brantford location, a lot of people were like, oh, like you're so brave, you're so, and I was thinking, until they said that, I was like, why? Because in my head, I was like, this is a great idea. It's not gonna fail. Like I never thought about it not working. I was just like, there's a need for this. I want to be the one that brings it. I'm gonna do it. Like I don't know. We're the very first osteopathic walk-in center, so you can actually just walk in and get treated. Whereas there's like a backlog of needing osteopaths, like sometimes even 3 months. So having a walk-in has been a pretty, like it's a really neat idea. And we're getting a lot of people who see other osteopaths who just need to get seen right now, and then they start coming back. So, I mean, it was a great business idea, and I was just like, it's gonna work, and now when this whole thing hit, I was like, did I make the right choice? Like, and part of me really regretted opening it, to be honest with you. Brantford, I can deal with Brantford. It's a really small rent. It can, it's lucrative from the start pretty much. Whereas Oakville is like, it took me a year to be able to pay my rent. So, I mean, my loan also included paying my rent for all that time. So, I mean,
Holly, it's interesting, part of entrepreneurship is being open to taking risk and being willing to fail. And this also, as I'm listening to you in Pete, what you had said, it might really cause people to mitigate against taking those risks because it's there's a lot more unknowns now as well, isn't there? So, well, Holly, Pete, we're just at the brink of our time right now, but I want to really thank both of you for the time you took. I do apologize, Ian Ladmurray, Middlemost here. I know you're on the line right now, and I know you can't join us. I'm going to call you both separately when we're done. But I can make sure that our audience has a benefit from hearing from them in a separate format. But Holly, Pete, I really, really appreciate the time you took. I appreciate your insight. Holly, your raw passion for what you do and how this has impacted you it has just flown out on the camera today. It really has. And the fact that you take this home, my dad would always tell me that, that you had dinner with your business every single night. If it was a great business day, it was a great dinner. If it wasn't, well, maybe it wasn't sometimes. And that's something that it really is prominent with what you're saying right now. It really is. And Pete, the benefit of your experience and who you've been speaking with, you're not dealing just with one business. You've got many that you're dealing with right now with similar things. So I do really, really appreciate sincerely both of being on the line. And to the audience there, this is our first one. Like any entrepreneurial venture, you have failures, you have successes. I think the conversation has been great. We will work on this technology and make sure it's fantastic. We do have 3 sessions next week that we're hosting on mental health in the workplace. This meeting today has actually almost been a natural segue to that, isn't it? Because
yeah, for sure.
Holly, you and I have talked before this even about the stresses sometimes of owning a business. And so we are going to have 3 sessions next week. Monday is going to be on mental health for business leaders. Tuesday is going to be for mental health within the workplace, the stigma and what to deal with. And then on Friday is actually going to be a course on mental health first aid in the workplace to make sure that the businesses are more equipped to deal with some of the challenges that we have. I always say that mental health has been prominent. COVID has only really accentuated how badly we're dealing with this right now. So I invite all of you to attend that. And that is it for me. Holly, Pete, thank you so much again.
Thank you,
Ian Murray, thank you very much for kind of sticking with us in whatever shape you could. And I appreciate everybody's time, and we'll take care.
Thanks, everybody.
Thank you.